All right, so again, Dr. Brant Green with Annapolis Pain Management. I guess you want a little bit more information about the specifics on the knee pain protocol that we have. Happy to share. So, as far as the medical component of our knee pain treatment, in most cases, what we start with is what's called hyaluronic acid injections or viscosupplementation therapy. You may know these as what's called a gel injection. Now, the thing that you have to understand is that not all of these gel injections or these types of therapies are the same or they're created equally. Not only from what type of injection is used as far as the drug itself, but also how it's performed. So in our clinic, what we do is we try to always use the best version. So in our clinic, we use Suparts or Hyalgan, which are the top tier versions of this drug. These are 5 injection series injections versus a 3 or a 1 injection series. 5 is better, more is better as usual. And the reason why that helps is because we're spreading it out over time. The other big benefit of these two types, Hyalgan and Suparts, is they are natural. And so your body absorbs them more effectively, more efficiently, versus the synthetic types that are made using a process called biofermentation. Your body tends to not accept them as well or absorb them as well and tends to be more inflammatory reactions. So we opt for the better version, even though it takes a little bit longer. That's one component of it. The other component that's really important as far as getting an effective injection into your knee using this type of treatment, hyaluronic acid, is if you're using guided imaging. And so what we know through experience and what also the data and the research shows is that when you use image guidance like ultrasound or fluoroscopy, you have better accuracy and more effectiveness. And so we can actually make sure that the needle is going in the correct spot. A lot of times when you go to the orthopedist, no harm orthos, so it's not an attack, but tends to be non-guided injections. And so it's just for the speed and efficiency. And a lot of times you're having a physician's assistant do it. And they do them all the time, and I'm not saying they're not good at them, but a lot of times they're not using that imaging, and it does make a difference. And so in our clinic, we use a high resolution digital ultrasound, and we see that makes a big difference. Another component that's really important in the physical medicine side is a lot of times patients have knee pain due to arthritis, right? And so it's that deep knee achy pain, especially in the mornings. But as we treat that with these types of knee injections and we run you through our other protocols, a lot of times, even at the end of those injections, you're still having some pain. And as we go down the rabbit hole a little bit further, we find that the soft tissue or those tendons and muscles around your knee are irritated as well. And so there's inflammation in there. So even if we treat the arthritis correctly and we resolve that issue or start to improve it, the tissues on the outside, the tissues around the knee that are holding everything together can also be irritated. They need to be addressed as well. And so we have solutions for that. We have some specific types of treatments that are non-opiate, that are local anesthetic that can help break that pain cycle, get that inflammation down, make your knees feel a lot better very quickly. Another big important protocol that we implement with almost all of our knee pain patients that have arthritis is we do customized bracing. And nobody wants to wear a brace. We understand that. I wouldn't want to wear one myself. But what we find is that if it's fit correctly and adjusted properly, we use the good versions that we can do that with, is that it takes pressure off the knee. It actually unloads the knee where that arthritis is and allows the drug to do its job more efficiently. The other component is it's going to help you walk better and move better while you're going through this therapy over that 5-week period. Okay, so that's 2 of the things that we do that's very specific, very unique. The third thing that we do is we start physical therapy as soon as you are ready. We do not wait till the end of the injections. We do not recommend you do not do physical therapy. If you have enough knee pain that you need injections, or if you have to have knee treatment, it's probably changing the way you move, the way you sit, the way you stand, the way you walk, and those movement patterns need to be addressed. We need to strengthen your legs, we need to mobilize your legs, and get things moving from your feet all the way up to your hips and into your low back. That whole movement chain needs to move well and needs to move correctly. And the only way you can do that is with a very good protocol for PT and rehab, or just functional rehab. And so we have experts in that in our clinic that do that. So the physical therapist, along with the chiropractor and the manual therapist, all work together at the same time to help mobilize those joints and then mobilize the tissues and then strengthen and stabilize everything towards the end. And then as you're sprinting or running out of the office, you're going to be a very, very happy person. So that's a little bit deeper down the rabbit hole. So it's the combination of those types of procedures, physical medicine, physical therapy, chiropractic, manual therapy. Now, sometimes obviously all of those aren't for everybody, and we understand that, and and that's ultimately up to you. It's your decision. But we find that the combination of those therapies is what gets the best results. And so if you have more information, the best thing we can do at this point is just to take advantage of this free consultation offer that we're offering, and we can get you in and sit down with one of our providers and go through what's going on and see if it's something we can help you with or not. And then beyond that, if you've already had those injections, you've already done rehab and PT, we do have some other options in the regenerative medicine field. So things like amniofix, which is a amniotic membrane. Basically, it's going to help put a lot of growth factor into your knee or into your joints or into your tissues. So if you've got damage, this can actually help regenerate tissue and help grow tissue. And so it's kind of right up there with stem cells. And so that's something that we currently do right now. And stem cells and PRP are all those things that are options as well. So again, if you like to take advantage of the free consultation, you're not going to get a better opportunity than this. And so you can always just give us a call too. 410-224-4348 is our clinic number. It's never going to change. Or again, best thing to do is just put your information in the box below, and Pam or one of our other amazing staff members will reach out to you and we'll get you in as soon as we can. Okay. Looking forward to meeting you and hopefully get you feeling better, and we'll talk soon. Bye-bye.